This is Jerry Hesch with the Hesch Institute, and I have a brief client interview. And go ahead, and she's with her daughter. You'll probably hear the daughter in the background, so let her speak.
Yeah, I had a wonderful experience with Dr. Jerry Hesch.
But he's not a doctor, he's a physical therapist.
Okay, it's a physical therapist.
Jerry Hesch.
Yes, Jerry Hesch. And I had pain all across my body, like the shoulders and the backbone and the pelvis area, in my leg, in my foot, everywhere. And Mr. Jerry just removed the pain immediately, like in 2 sessions. My shoulder were more straighter than before, and always, it was not properly diagnosed. Even like whenever I was going to the massage parlors, to the doctors, or so, wherever I was going, they were
Did you see physios also?
The physios also. They were just saying that it's kind of an acute stress that is accumulating on the back, on the lower back, as well as near the shoulder area. And probably if I had an accident, so it was so stiff. And Jerry, he just did wonder, he just pressed certain points without pressing too hard, and my pain, it just vanished, and I feel more calm on the shoulders area, in the neck area, and in the pelvis region. And it was really amazing results indeed. And also I wanted to describe about my foot pain, which was not going at all. And he just simply manipulated the foot, and within, I believe, in less than a minute, the pain vanished. It was all gone. And the thing is, the country where I live is not my birth country, but I did not get this kind of treatment over there. We don't have this kind of professional doctors or physical therapists who can pinpoint the problem and then alleviate the pain instantly, like Jerry did. And my daughter, she also was experiencing this tummy ache and shoulder stiffness she's like 3.5 years old, and ever since she was born she had been very stiff. And Jerry, he just he manipulated her joints from the back, from the shoulder and the lower back area, and for her also, she felt free. I can feel that she's more freer and less stiffer.
Was it a forceful manipulation?
No, it wasn't forced.
How long did it take at each place?
It was about a pressure about 2 minutes. Minute or 2, and that's all. And he told me also how to just relieve her from the back pain.
So what effect did she achieve with that?
She's much more freer, and now for the tummy area, it's much more softer. Because for tummy also, she have had this pain for so many years, like ever since she was born. And we used to think that she was colic, and the pain was not going away. But with this thing now, at least she's been able to sleep through the night, and that's helping us out.
I get her feet in the camera, and I really don't know how that helped to the stomach. I made no claims to be able to help it.
Yeah.
I'm pleased that that's the outcome, but I do not make any claims that I can treat backs and help stomachs. Just for clarification.
Yes, certainly, but it helped in a way, probably because probably she's small. She had pain in the back, and it was going to her stomach area, probably. We don't know. Maybe there was some relation in that area, and it helped. So it was a wonderful experience.
And so for treating, so I did certain things, like I treated your foot in 1 minute, but then how do we know in 3 weeks what's going to happen with that foot pain?
Okay, then for that, you gave me certain exercises to do, and just explained me also through a video how to adjust any problem if I have any in future, and certain exercises which will just make me stress-free, pain-free in a longer run, so I can move in a better position.
And that's your hope. I mean, I'm very careful about making promises, right?
But I'm quite hopeful. I'm quite positive in a way, because I feel much better. Like my posture, I have had this problem for so many years, and I used to think earlier it was because of stress. But I was quite active in running, athlete, and I was going to the gym everywhere. And over there also I was doing certain exercises to keep my back straight, but that was not working out.
And so, when you came to see me, you and I thought this was a birth trauma.
Yes.
The worst of your pain started 2 weeks after you delivered your baby.
That's right.
And that was, what, 10 months ago?
No, that was 5 months ago.
5 months ago. Okay.
Earlier than that, I had the pelvic pain, and that you fixed up. The pelvis is now fine. But thereafter, you diagnosed that probably I had the hip pain. You were the one. Otherwise, before that, they were just telling me that it could be a possibility. Then you referred me to an expert.
Yeah, you had an MRI and they read it negative, but over here I sent you to a hip specialist.
Hip specialist, yeah.
And on the second visit, I made that discernment, we better get you over to the hip specialist.
That's right.
And I'll shut up now.
Yeah, exactly. And I'm so much thankful to you. You just made it everything very fast. Because I was from long distance area, I just flew it was a 15 hours flight, and then staying here. I had to extend my visit here though for about 2 to 3 days, but it's really worth it because I went to see the specialist and he actually pinpointed, he diagnosed what was the problem.
Yes.
It was in the hip, and you were the one who sent me over to him because you also had an idea that this could be the problem, which is not being treated just because of that, and there's no point wasting time in just running around and doing other manipulation techniques and that.
So you then had 2 tests. You had a repeat of the MRI, but can I say a better MRI or more specific or something like that?
Yeah, here they were saying it's more specific. It was MTI MRI. Yeah, and 3T MRI, whereas that was not done in the country where I live, and there were, I went to various doctors, even to the orthopedic doctors there, and they were just simply telling me that it just probably happened because of this pregnancy, and it will go away, and just maybe you give it a month, 2 months, 3 months. But here, at least now I am at ease. I have the ease of mind that what is the problem. Now it's up to me whether I have to get it treated through the minor operation, or probably I give it some time to do certain exercises, which the physical therapist told me over there, the orthopedic physical therapist told me how to treat this probably, because he said to me this problem is quite common in the athletes also, labral tear. It's quite common in the athletes also, and this can be treated, sometimes can be treated through certain physical exercises. But there are aware of the term labral tear and the physical exercises for that. But the country where I live, they don't know anything about it. I visited to 3 to 4 doctors, the good ones, probably there could be any, but I did not find anybody. In general, I did not find anybody who could at least send me to a specialist. If they are not able to diagnose, at least they can refer me to some proper place, because that, otherwise, it results in more problems. I have started to experience blood pressure problems because of this thing, because I was under acute stress. What to do now? What next? I don't know. I've been running here and there. Here working, going to this doctor, going to that medical clinic, so
So and if the conservative care doesn't work, then you may end up with some surgery on the hips.
I will look into that. Yeah, because I have 2 small children to look after, so I want to be really healthy, staying with them. Then of course I'll look into that. But I'm a bit, bit hesitant to get this treatment done in the country where I live, because I'm not sure, even maybe they have those kind of surgeons, but
just haven't found it yet.
Yeah, I haven't found them yet, and I'm not sure what are they going to do.
yeah. Well, we look forward to finding out if with conservative care, in 6 months' time or so, find out how it's doing.
Yeah, sure.
And what's nice is that the level of pathology doesn't mandate that you get it Monday morning.
That's right.
It's not very urgent. It is there, but it's not horrible. I think that once you understand the problem, I think you feel better about it. I think we all do.
Yeah.
Because now that you know what the core problem is, and we've addressed the other ones, but that I would call peripheral problems, but now that you know the core issue inside the hip joint, it gives you more sense of peace and sense of power, sense of choice, and maybe a more direct route to
Surely.
So I'll stop talking and I'll let you just kind of wrap it up.
Yeah, so, I just recommend anybody whosoever has a problem to come and see physical therapist Jerry Hesch. Like, he does really wonders, like a magician. And I'm really amazed. And it's not that you just, the thing is, you just have to find him. And then you have to get him, If you just see his website and if you find there's a cure, then please do visit him.
Thank you for the kind words.
Yeah.
And I think that... I think one of the clearest things is I can't make claims, and I don't wish to make claims except to be very thorough and very focused. And probably what I think is very helpful is that the visits are 2 hours long.
Yes.
I have 120 minutes of you focused, looking in, and a lot of communication before you got on the airplane.
Certainly.
We
yes.
had spoken 3 times.
Yes,
we
yeah.
have read reams of data, reams of
Yeah.
reports and such, and tried to get as much information as we could.
Certainly, yes, yeah.
And
so you just made the thorough study first before I was coming over here, so we did not waste time. Because earlier I have had like about 30 physical therapy sessions, but it didn't work out
yeah.
to the extent
and to be honest with you, I was very concerned about you.
Yes.
I try not to have people fly out to see me if they can get the right care locally.
Certainly.
And I was so worried. And I really thought it was a birth trauma.
Yes.
I thought you had instability in the pubic joint. Well, you didn't.
Yes.
That was not the core issue. We did a little work to the so-called SI joint, the pelvic region in the back and that, in the low back and such. Did some work to the hip, but found our limits
Yeah.
on the hip. But at this stage, I'm so pleased because I feel like it's... I had some anxiety about you coming, and I just hoped that I would have something to offer, and I know that in fact that we did. So I feel better about it also.
Surely, but you did a wonderful job, sir.
So thank you so much,
Thank
and it
you
was
so
a
much.
delight treating
Yeah.
your daughter. That
Yeah,
was
certainly, yes. It
she's
was
a
also,
cutie.
yes. Thank
very
you.
enjoyable. So thank you so much.
Thank you so much, sir. Take care.